Have you ever thought about this? What if I told you that a burn the size of your palm could actually be more disabling than a massive burn covering your entire back? I know it sounds kind of crazy, but when that injury is on your hand, even a small burn can have absolutely life-altering consequences. Let's get into why that is.
So how is that even possible, right? How can a small burn on your hand completely change your life more than a much larger one somewhere else? Well, the answer is all about the incredible, mind-boggling complexity of the hand itself.
You see, your hand isn't just a patch of skin. It's this dense, intricate machine. It's just packed with tendons, muscles, nerves, all working together in perfect harmony. It's our #1 tool for interacting with the world. So any damage here compromises our ability to grip, to feel, to do literally everything, from buttoning a shirt to sending a text. And get this, even the skin on your hand is totally specialized. On the back, it's thin, it's loose, which means when it gets burned, it swells up like crazy. But on your palm, the skin is thick and tough. Now, that makes it more resilient for sure, but a deep burn here, it's a massive challenge for surgeons to repair. Think about this number for a second, 1%. The entire surface area of your hand is only about 1% of your body's total. Just 1%. And yet, because it is so functionally important, a deep burn to this tiny area is always classified as a major severe injury. That's just how critical our hands are. So when a burn happens, what's really going on at a microscopic level? Well, the process is called coagulative necrosis, which is just a sciencey way of saying the heat literally cooks the proteins in the tissue, causing the cells to die. But the damage isn't all the same. And this brings us to Jackson's burn model, which is just brilliant. It shows that a burn has zones. The center, the zone of coagulation, that's gone. Irreversible. The outer ring will most likely recover, but that middle zone, the zone of stasis, that's the battleground. The tissue there is at risk, but it is salvageable. And this is where what you do in the first few minutes can literally save tissue from dying. There's another huge danger, especially with burns that go all the way around a finger or a wrist, and that's swelling. Your hand is made of all these tight little enclosed spaces, or compartments. So when massive swelling happens inside, it can actually squeeze the blood vessels shut, cutting off all circulation. This is a surgical emergency called compartment syndrome, and if it's not treated fast, it can lead to permanent damage. So what's causing all these burns? You know, overwhelmingly, it's accidents in places we feel the safest. Nearly half are from scalds, a spilled cup of coffee, hot cooking oil. The rest are from flames or just touching something hot for a split second, like a stove. It's a pretty stark reminder of how quickly a totally normal day can turn into an emergency.
Okay, so not all burns are created equal. It's really all about depth. First degree, that's superficial, like a bad sunburn. Second degree goes deeper. You get those painful blisters. But here's where it gets kind of counterintuitive. A third-degree burn, which destroys all the skin layers, it's often painless. And that is not a good sign. It means the nerve endings themselves have been completely burned away. And beyond that, fourth-degree burns are just catastrophic, reaching all the way down to muscle and bone.
All right, now that we understand the damage a burn can do, let's talk about the single most critical factor in recovery, you. What you do in the first few minutes after a burn happens can make all the difference in the world. Your immediate response is honestly the most powerful treatment there is. So, what's the secret to effective first aid? It all comes down to one number. If you take away nothing else from this, please burn this number into your memory. 20. This simple number is your guide to minimizing damage and saving that critical zone of stasis we talked about.
Here's what it means. First, and this is obvious, stop the burning process. Second, cool the burn under cool, and I mean cool, not ice cold, running water for a full 20 minutes. This stops the heat from continuing to cook the deeper tissues. Third, remove all jewelry immediately. Swelling can turn a ring into a tourniquet super fast. And finally, cover the burn loosely with something clean, like plastic wrap or a cloth, just to protect it.
And let's be absolutely clear about what not to do. Do not use ice. Ice can cause even more damage to that fragile skin. Do not put butter, toothpaste, lotions, or oils on the burn. These things can actually trap heat and increase the risk of infection. And please don't pop any blisters. They are a natural sterile barrier.
For any serious burn, professional medical care is just non-negotiable. This means advanced dressings and pain management, but it can also mean emergency surgery like an escharotomy. That's a procedure to release pressure from swelling, or really complex skin grafting and reconstruction down the line. And make no mistake, recovery is a marathon, not a sprint.
This timeline really shows that the journey is long, it's demanding, it involves therapy, maybe surgery, and wearing specialized pressure garments for a year or even more to control scarring. It is a massive, massive commitment.
This quote is just so key. The goal with a hand burn isn't just to heal the skin, it's to preserve function. To stop the joints from getting stiff and contracted, therapy and proper positioning with splints have to begin immediately. It's not an afterthought, it's a core part of the initial treatment from day one.
So after seeing the complexity of the injury and just how difficult recovery is, the best strategy becomes pretty obvious, doesn't it? Prevention. Simple things like being careful in the kitchen, using protective gear, and making sure your home is fire-safe are the most effective treatments of all.
And so we come back to this. Our hands allow us to create, to care for others, to work, to communicate. They are our most vital connection to the world around us. So the final question this leaves you with is a simple one. How will you protect your most essential tools?